I've been having an upper respiratory tract infection for the last 2 days, so I apologize for that. Today, I have been given the honor to join this elite panel of expert speakers and to be a part of this fantastic event that is addressing research in the medical field. And I was given the opportunity and the privilege to actually give one of the most important lectures, I think, in the entire event, which is basically coming up with the question. Obviously, this is my disclosure slide. I have no conflicts of interest of any kind. Doing and getting your research question is probably one of the most important things you can do, if not the most important, because everything else depends on the question that you choose. Basically, what we are trying to do whenever you have a research project, you're trying to apply a scientific method to a problem that you want to find out the answer to. So the idea is to formulate your question and then to find a representative sample from the population that you have, whether it's your region of the world, whether we're talking about extension of the results to everyone. If you can do that, obviously you can't do that in a lot of topics. The idea is to find a control group and an experiment group, and you keep everything the same, and you change one little aspect, which is basically the thing that you are trying to study, which is your question. So later, when you get your data and you get your results and you go through your analysis, you can actually attribute the results that you get due to the change between the two groups. This is basically the idea in a nutshell. So please bear in mind that the most important step in any research project is actually putting your question together. This is the most difficult step. It should take quite a bit of time. It should take quite a bit of brainstorming. The idea is that it's the cornerstone. Based on this question, you are going to choose your design, you're going to choose your time, how many people you're going to have working on the project. This is basically the heart and soul of everything. So if you choose your question and then you decide to change it, everything else will change with it. That's why it's so important for you to actually get this right from the beginning. Having said that, once you choose your question, believe it or not, the idea is for you at the end of the research is to actually have useful knowledge to contribute to the knowledge that is known about the subject. Now, as Professor Gary has been saying, and as you will know, and as I'm sure most of you are aware, you do need to make or publish research to get promoted, to get more grants, to advance in your career. So this mentality of publish or perish does exist in every community, but if you really want to come down to it, research should be done to improve the knowledge that we have about a certain subject. And of course, just as you formulate your question, that in itself is a mini research project on its own, to go and find out what's been done in the topic that you chose, the idea that you chose, what you're actually trying to research. This by itself is actually a research project on its own. It might take you a couple of weeks, it might take you a month, but the idea is for you to put a research question that is proper and valid and good to start with, so that everything else that follows and everything that you build on it is solid and reliable. So, how are you going to do that for your research project? I get a lot of residents. I see a lot of students that basically want to have me supervise their research. And the first thing that I hear from them is basically, I don't know, why don't you give me some ideas? Well, the first thing you should do is choose something that you like. That's simply common sense. You're going to be doing the research project for God knows how long. If it's, for example, if it has to be finished within 3 months, or if it's going to be over at the end of the year, or for example, in the emergency medicine program, we give residents the obligation to finish one research project throughout their residency. So they have 4 years to finish one research project. So if it's going to take time out of your schedule, out of your studying, you should find something that you like. You should go back and read about it if you already didn't read about it. Choosing something that you like, you already have a background. You already have done half the work. You've read books about it, or you're interested in it and you're already reading about it before you decided to go and do a formal study. So it just makes sense that you actually pick something that you want. After you do that, so you might have a rough idea. So I want to do something, I want to do research about PE. I want to do a research about acute coronary syndrome because I like acute coronary syndrome, or ECG, or VBG, or whatever it is. Basically, first things you need to do is, okay, find out, was your idea done before? You would be surprised how many times I would choose a topic, and then when I go to research it, I find that, oh, it's been done already. And in a number of times, actually, it's been done better than I thought it would be. So once you have an idea, go back and look at what has been done on the subject. Where is the research right now with regards to that idea? Did somebody already do the idea? Did they do it the way that you are envisioning to do it? Sometimes we may redo ideas that have been done before simply because they weren't done in the same way that we think they should have been done. Or because that study that previously researched that topic had some problems. It had some limitations. So now you are trying to duplicate the study, and you will go beyond the original study done to improve on the design. Whether it's a new piece of equipment, whether it's a new data collection tool, whether you're doing things more meticulously, whether you're using a bigger sample, whatever it is, you can do other ideas that have been done before, but you're going to be doing them better. So this is acceptable. So the idea is to go back and refine what you have. Sometimes by going through the literature and looking up what you want to research, you may stumble on a question that is better than the one that you thought of. You know, instead of doing this, oh no, this is more interesting. I would much rather do this than that. Okay, so this is definitely there. So when you're coming to choose a research question, there are 6 main steps that you should keep in mind. The idea for you is, when you have these steps, is so that you don't need to basically retrace your steps and fix things after you start the project, and then you would be retracing your steps, and you would have your data half taken with an old set of rules, and then you've changed them, so the other data is taken with a new set of rules. So basically, get it right from the beginning so that you will end up with a reliable set of results. So going slow and going smooth is the way to do it. Don't rush into it. Get it done, but the idea is to get it done right. So step number one, your question should be understood by everyone. So when you ask the question of what you're going to research, you shouldn't be explaining your question to people. If you find yourself having to explain your question, then it's not going to be clear. Your question should be clear from the get-go. People should understand what you're trying to do from the moment that they read your question. The mark of a bad question is basically you have to explain it to everybody. Okay. Plus, it shouldn't be something simple. It shouldn't be a yes or no answer. It should be something that you need to actually analyze the data. Yes, in the end, the essence of the question is a yes or no. So for example, is there benefit to giving steroids in septic shock? In essence, the answer to the question is yes, there is, or no, there isn't. But to get to that, you need to do a lot of work, a lot of analysis. You need to make sure there's no confounding factors. You need to make sure there's no bias, or at least the bias is minimized, and so on and so forth. And of course, you're going to go through all of that in detail with the other panelists in the other talks within this event. So first of all, you have to make it clear. Second, you have to have some idea with the money and the means at your disposal. So I see a lot of students, they want to do really amazing researches. However, they don't have money, they're not funded. And as Prof. Gary already mentioned, getting funded, that on its own is really an odyssey. It's a big thing. It has to do with institutions. It has to do with where you work, your stature, your experience, your connections. There's a lot of politics involved, and I'm sure that everybody realized that. So for the most part, as far as you're concerned, as a student, as an intern, even as a resident, or even as a consultant, a lot of the research is going to be conducted with no money, or at least personally funded from your own pocket. And I've seen this time and time again. So the biggest limitation factor is how much money do you have? How many people are you going to have working on your project? The more people and the more money, the fancier and the more detailed your study can be. Sometimes you don't need a lot of detail. It's just simply, it has to do with your question. If your question is a simple one, then you don't need a lot of people. You don't need a lot of subjects. You don't need a lot of money. You don't need a lot of equipment. And basically, you can get the study done with next to nothing. And these are kind of the mark of a good study. When a study is so simple and so easy to understand and doesn't cost anything, and basically the results end up changing a guideline in management, these are the best kind of studies. Of course, they're exceedingly rare. However, having the money that you have and the means that you have is basically what dictates what you can do. And obviously, as your study grows and as you get a grant, or if you start to have money from big pharma and things like this, there's a lot more involved. You're more under pressure to actually produce positive results than just to find out what the truth is. After all, if somebody gives you a lot of money to do a test, and then your final result says that, oh, there's no benefit to this, it's kind of a downer. So a lot of people are pushing to get positive results once they get money. The third thing is, how much time do you have? How much are you willing to invest from your time, from your life, from your career, from your job to actually do this project? And is it worth it? For example, if you are a resident, you have to spend time to do this because this is part of your graduation assessment. If you don't do the research, you don't graduate. So it's just as simple as that. So yes, you are very invested in this. So how long do you have? Is it something that you need to finish within the year, or is it something that can be done over several years, which is usually a bigger study? Are you a part of a study group, or are you the principal investigator and you're running the show on your own? So again, this is going to play into the type of question that you can ask. The fourth thing is, how difficult is it to actually do your study? Can you collect the data easily? Is it something invasive? I mean, you can, for example, do something that is, extremely scientifically interesting, but to get the data is extremely, extremely hard. Are you going to get it from multiple sources? So if, for example, I'm conducting the study in the western region of Saudi Arabia, does it hold that the same results will occur if I do the same test in Riyadh, or if I do it in the Eastern Province, or if I do it in China, or if I do it in the United States? So this has to do with how global you can do your generalization. Is the data scarce? Are you studying something that's really not that common? So for example, I see a lot of people who want to, for example, do a study on surgical airway. Now, surgical airway, by definition, is really not that common. It's quite rare. There are institutions where this is somewhat common simply because they have a bigger flow of patients. They have a more serious kind of cases that come into the ER. But in general, most of the residents, they go through their residency not having to do a single surgical airway. I have been in practice now for 18 years. I've done 3 surgical airways in my career. So it doesn't mean that, I'm working in a place that is not seeing critical patients. It's just that this type of cases tend to be rare. And therefore, if I need to get, for example, 200 or 300 subjects or cases for my research, that's going to be very, very difficult. Unless I move to somewhere like, for example, South Africa, where trauma is extremely common. You do surgical airway, almost every other shift. So is it hard to get the data? Is it hard to record it? Do you need a lot of equipment? So all of this has to go into your consideration when you're thinking about your question. Is the data available? Is it proprietary? So for example, the data is available, but unfortunately you can't get to it. So maybe it's owned by a company, and therefore it is legally their property. They're not going to let it go unless, for example, you pay them. This has been very prominent in everything that has to do with Big Pharma. For example, when they did the research on Tamiflu, it took them about 4 years to get the data from the company. So you need to think about how are you going to get your data. Step number 5, the ethics, and everybody knows this. It's very interesting to know, does drug X cause teratogenicity in pregnant women. Unfortunately, you can't go and just, give a number of pregnant women the drug and have another group as a control and see who gets congenital anomalies. This is something which is unethical. So, does your question or does your research put patients at risk? And if that's the case, then you're going to be having a problem with the Internal Review Board, the IRB. Of course, that is going to have a lecture on its own, so I don't want to go into that. But you're going to have to deal with a lot of monitoring, a lot of oversight. You're going to have people from the Internal Review Board kind of keep an eye over your shoulder and look at your data and make sure that nobody's being harmed. So again, how big is the harm? Is it just a simple gastroenteritis from the drug that you're administering? Or is the patient going to have a serious infection and end up in the ICU or lose a limb? So depending on how risky the work is, the ethics committee is going to step in and moderate what can and can't be done. And in the end, is it worth it? After you've spent all that time and all that money and all that effort, did you actually get what you want? And is it actually contributing to what you thought it would be? So your question has to be focused, okay? It has to deal with a single problem. You can't have a question dealing with multiple problems. Just have it look at one specific problem, okay? You can get data during the same study for a number of questions. If you're going to apply the same population, you might as well collect as much data as you can. And then later on, after a couple of days, we have a lecture on how to clean your data, which I have the privilege of actually delivering. I'm going to tell you how that some of your data that you collected may not be necessary. But the idea is you're going to go through the effort and you're going to go through the time and you're going to spend the money. You might as well get as much data as you need. And then if you don't need it in the analysis, you can take it out. Okay, so basically everything you need to do is to address a single problem. And that problem has to be researchable. Your question has to be answered by collecting data and analyzing it. It cannot be something that cannot be answered. So for example, if you want to do a research on the question, what happens after death? Okay, so you can't really answer that question because we do not have subjects that return to life after death. So this is a dead-end question because you cannot collect data and you cannot analyze that data and answer the question in the scientific method. You can answer the question philosophically, yes, metaphysically, yes, but we're talking about the scientific method in medicine. So it has to be something that's researchable and answerable by collection of data. It has to be feasible, which means it has to be within your means, whether it's time, money, people. Okay, so don't pick something that you can't do because you don't have the money or the funds for it. It has to be specific, okay? So you have to define everything. When you say, is there a benefit? What does that mean? Are you talking about mortality? Are you talking about morbidity? Are you talking about, the duration of symptoms or whether or not the patient has complications? So when you talk about benefit, what are you exactly talking about? You need to have this defined, okay? So basically, you have to adhere to this definition throughout your study so that other people who pick up your work can actually find out what you've done and build on that for future studies. And of course, in the end, it has to be something relevant. It has to be important to the specialty that you are in. And I cannot tell you how many things that have been done that really have been a waste of time just for your entertainment and to make you laugh a little bit. I've actually compiled some of the worst studies that have ever been published, mind you, in good peer-reviewed journal. So for example, look at this comparison of the jumping performance between a dog flea and a cat flea. They actually went and measured how much or how high a cat flea will jump versus a dog flea. Now, so what if the dog flea jumps higher or the cat flea jumps higher? How does that increase our knowledge of this? For example, this is another study, swearing as a response to pain. So swearing increases your tolerance to pain. If you actually have pain and you start to swear, this is, you can tolerate pain better. So this is actual studies where money has been spent and you're actually going and putting in the effort and the time to collect useless information. Are full or empty beer bottle sturdier, and do they cause skull fractures? These braking energies surpass the minimum fracture threshold. So if you have a beer bottle and you throw it at somebody, it's more likely that they will fracture their skull if it's full. Well, that kind of makes sense, I guess, but did you actually need to spend money to study this? Elucidation of chemical compounds. They actually went and studied the chemical compound that makes your feet smell. And they succeeded in actually knowing what were the chemicals. How relevant is this? Which feels heavier, a pound of lead or a pound of feathers? Really? Does it matter? They actually went and measured the people's response to this. It's amazing. Chickens prefer beautiful humans. They actually trained chickens to react to the average human, and they found out that they actually prefer beautiful humans. And of course, my favorite study of all time, the nature of navel fluff. These people actually went in and they took it's right here, they took 500 people and they collected the fibers and the cotton and everything inside the belly button of these 500 people, and they measured how much does it weigh. How does this benefit and propel scientific knowledge? This is just a waste of money, a waste of time, and a waste of effort to do something that has no relevance whatsoever. So you need to have your question actually having substance. Okay, so now that we've talked about the question, what about the hypothesis? What is the hypothesis? First of all, you have to understand that the hypothesis is not the question. The question is the thing you're trying to study. The hypothesis, the definition of the hypothesis, is what do you think the result will look like? What do you think the answer to your question will be, given the information that you already have before you do the study? Okay, so you're not answering the question based on data that you do have. It's basically you're predicting what's going to happen. So, for example, giving steroids in septic patients, I'm thinking that my hypothesis is going to say that they do have benefit. For example, okay, based on the pathophysiology of sepsis, based on what we know of the corticosteroid drugs. So based on what we know, we are predicting that they have benefit. Now, the whole idea of the project is to actually go ahead and prove the hypothesis. So that is your hypothesis. So when studying an effect of a treatment, basically you have two outcomes. There is no third. It could be that the treatment does have an effect, and this is usually our hypothesis. We say that according to the knowledge that we know right now, before conducting the study, we are predicting that drug X has benefit. Now, we have no evidence to support this. We are making a prediction. We are making a hypothesis. The null hypothesis is the exact opposite. There is no effect. Okay, so we are predicting that there is an effect. Now we're going to run the study, and if we find that there's no effect, this is what we call the null hypothesis. Now, the problem is that we cannot prove a hypothesis. The null hypothesis simply says that there is no difference between the experimental therapy and the control therapy. There is no difference or correlation between the two groups, or causation, or whatever relationship that we're studying. If you give drug X to these patients, are they more likely to survive? So the null hypothesis is no. If you give the drug or you don't, the number of people that are going to die is going to be the same. So the null hypothesis is always that there is no benefit, no correlation, no causation. There is no effect of whatever it is that you are studying. In other words, your hypothesis that there is an effect is actually wrong. That's the null. Now, why do we have to go through all of this? This has to do with the type of reasoning that we're doing in scientific research. Now, reasoning comes in two flavors, okay? There's deductive reasoning. Deductive reasoning goes from the general to the specific. This is basically how truths are derived. So mathematics and logic is deductive. Okay, so for example, all humans eventually die. John is a human, therefore John will die. So this is deductive reasoning. Based on the fact that all humans die, and based on the fact that John is a human, it follows logically that John will die. So we know that the death of John is going to be a truth based on this reasoning. Now, the problem is that in medical research, we do not have deductive reasoning. Deductive reasoning goes from the general, all humans die, to the specific, John is a human, and therefore John will die. In medicine, we do something called inductive reasoning. And we go in the opposite direction. We go from the specific to the general. And because we go from the specific to the general, we don't have a truth. We have a theory. And now we are trying to prove the theory to be correct. Okay, so all medical research is inductive. So it's like saying drug X lowered the blood pressure in Peter. And Peter is a hypertensive patient. Therefore, drug X is going to lower the blood pressure of everybody who's hypertensive. So here I went from Peter to everybody. When in the other example, we went from humans down to John. Now, the problem is for me to prove this statement, That means I have to give drug X to everybody on planet Earth who's hypertensive. I have to check that drug X actually does lower the blood pressure in every single human that ever was on planet Earth. Now, obviously, this is not something doable. Now, because it's not something doable, what we get is a theory. And a theory, the more you test it and it stands true, the more solid it becomes. Just like gravity. Gravity is a theory. It's not a truth. It's a theory because you cannot prove it. Gravity says that every time I let something go, it will fall to the ground. Why is it a theory? Because in the past, every single time that I did that, that item fell to the ground. But to make this a truth, am I sure that this is what's going to happen in the future? Well, it's more likely the more you test a theory and the more the theory is found to be true in each instance, the stronger the theory becomes. Okay, so for example, when we started to give thrombolytics in MI, we gave them in a small bunch, and then we gave them in a larger population and a larger population. And every single time we tested thrombolytics in acute MI, we found that there is a benefit. Now, obviously, there are patients who I'm going to give thrombolytics to, and they will not have any benefit. But so far, in 60, 70, 80 studies that we've done on this subject, in every single study, we have found that there is a benefit. So this is a strong theory. So that is why we are having to do inductive reasoning, because we apply whatever it is that we're studying on a small population, and then we generalize it to the entire species. Now, obviously, the problem is there's no logical method to prove the validity of a premise, to prove that a theory is correct. However, I can prove a theory to be wrong. So, for example, if I say this duck is black, therefore all ducks are black, this is a theory. Now, I cannot prove that all ducks are black because I have to check every single duck on planet Earth. Now, I can disprove this theory. All I have to do is find one duck that's white, and that disproves the theory. So it's much easier to prove the opposite. So if our hypothesis is that there is benefit to giving this drug in this population, then to prove that, I have to show that the null hypothesis is wrong. The null hypothesis is the opposite of my hypothesis, so I have to show that this is wrong. I'm going to assume that there is no benefit, and then I'm going to run the study, and the data is going to show me that there is a benefit, even though I started with the premise that the null hypothesis is wrong. So for any study, we assume that the agent that you're testing has no effect. And then we run the study, and if the study shows that there is an effect with a significant margin, it's unlikely to be due to chance. Obviously, the speakers who are going to talk to you about data analysis and p-values are going to show this. So this means that I can prove the study. And you use this even when you're talking with other colleagues. Okay, if you want to prove your point, you're going to say, let's assume that you're correct. And I go through the reasoning, and then I will say, even though I took your side, it still proves my point. And therefore, you are wrong. So this is the idea for making a hypothesis. So how can I choose a strong hypothesis? Well, first, again, I'm going to ask my question. So my question has to be clear, has to be defined. Okay, I'm going to perform a literature search to check what has been done on this subject. And our next presentation after the break is going to be how to do the literature review. Okay, so I'm going to check what was done about my question. Okay, that there is or isn't a benefit depending on what it is that I'm studying. Is there an association? Is there a correlation? Is there a causation? So what is the nature of the relationship that my question is studying? And then I'm going to refine my hypothesis so that it is specific and testable. You can check it for yourself. It contains relevant variables. So we're talking about things that can be measured, things like blood pressure or death or admission or the development of complication or the development of seizure or whatever it is that you are studying, but it has to be relevant to the question. And you have to do that in the population that you're interested in. Okay, so if you're doing this in the diabetic population, or you're doing this in ICU patients, or in pregnant patients, or in pediatrics. So you have to study the question in the population that you are interested in, and it has to address the outcome that you're looking for. What am I looking for? What is the benefit that I'm talking about? Am I talking about mortality? Am I talking about less days of sick leave, going back to work earlier or going back to school earlier? Am I talking about cost? If you give them this therapy, it's going to cost less, but they're not going to have the same side effects. Am I talking about less complications? So it depends what I'm talking about. So the way that you frame your question or the way that you frame your hypothesis should be as follows. You can do it in the if then phrasing. So, for example, if patients were started on drug X, then the number of people dying from the disease will be less. So this is the independent variable, and this is the dependent variable. Okay, so the number of dying people is going to be less. Okay, so this is one way of framing it. I can frame it in another way, a correlation and effect way. So starting people or starting patients on drug X will reduce the number of dying people from the disease. So this is the independent variable. If I here, am I going to follow the patients for 5 years? So the time that I'm going to conduct this experiment in. And finally, when you do the research question, remember that everything depends on it. The literature review depends on how complicated your question is. Your study design, are you going to do a double-blinded RCT? Are you going to do a survey, a cross-section study? Is it something very scarce that you have to do a retrospective chart review or a case control study? Do you have the means to do that? Do you have the people to do that? Do you have the money to spend? Okay. And can you collect the data? Is it difficult to get a hold of the data because of red tape or because of politics in the department or in the institution? And then you need to analyze your data. And finally, in which population are we talking about? So the question is everything in the research. And with that, I come to the end of my talk. Thank you very much.
Thank you, Dr. Anas, for this very outstanding and amazing lecture. Will you allow us to take a praying break for 10 minutes, then come back? Okay. So we will direct the questions in Q&A after prayer break. Thank you, Dr. Anas, and see you.
Thank you very much.
Thank you.